Hey y'all, it's Dr. Stevens. I want to thank y'all for joining us with our 12 Minutes to Health this week. I'm up here in McKinney, and I really appreciate y'all taking the time to jump in so we can actually give you the information that you need to be healthy. Because it's the information that you get and what you do with it that really makes the difference. Because yes, as a doctor, I want to make sure that you're getting out of pain, but I want to make sure that that's not going to be an issue that dogs you for the rest of your life. So I want you to listen in because we're going to be talking about vitamin D today. And Dr. Chris does a great job, so I know that I bring him in for my patients to actually listen in and get that information from the research. But today, I want you to do a couple of things. First off, I want you to get credit for being on here so that way you can work on getting that $200 to REI. Like us on Facebook, like us on Instagram, follow us. You know the rules. But the other part to it is I want y'all to ask your questions. And today, put your email in with your questions because I want to personally be able to answer them, and that way I can get back to you on a personal level for it. So let's listen in to Dr. Chris. Thanks.
Hey everybody, it's Dr. Chris with Texas Chiro Health, back for our 12 Minutes of Health. We do this each and every week for you guys. It's a chance for us to help give you a little bit more information on what the research is saying about how to be healthy. And for us, that comes down to eating well, moving well, and thinking well. Those are our 3 tenets of health, and that's how you're going to be able to maintain your health and stay as close to a maintained level of homeostasis as possible so that we can slow down aging, degeneration, sickness, disease, all that stuff. We just want to live a healthier quality life. So our 12 Minutes to Health is done each week. We go through the research. We look at all the randomized controlled trials, all the review of the literature, the real stuff that's inside the medical journals. That is the actual facts behind how to be healthy and what to do to maintain health and to get back to homeostasis. These aren't opinions. These aren't case studies. These aren't marketing research. This is the real medical literature that's going to allow you to live a healthier lifestyle. So I like to encourage everyone, as I do every time, to get into the office on Tuesday nights. Every Tuesday night at 6, we do our 12 Minutes to Health in there. We have the doctors are there. We have refreshments and snacks and green smoothies. But really, it's a great chance to get into the clinic, see what it's all about, but most importantly, get your questions answered. What I'm going to cover about vitamin D today could take me 6 hours. So I'm going to try to fit it into 12 minutes for you and just hit the highlights. But I know that leaves questions, right? And that's why Tuesday night at 6 is so important to get into the office. We have all of our new patients are there each and every week. And we invite anyone from the community to stop in, listen, grab some research, and get your questions answered. So with that being said, let's dive into today's review of the literature. It was done by Garland et al. It's called What is the Dose Response Relationship Between Vitamin D and Cancer Risk? Okay, so what they did is they looked at all the research out there having to do with vitamin D and cancer risk, specifically colorectal cancer and breast cancer. And so they put all that information together, they dug into it, what are the mechanisms of it, how much vitamin D do we need, where do we get our vitamin D from, what's its role in slowing down cancers, preventing cancer, stopping cancers, what kind of role does it play, and what does the real randomized controlled trials out there say about vitamin D and how it works on a physiological level, and also just how do we get it? What is the best way for us to get enough of it, and what is enough? Where should our blood levels be when it comes to fighting off breast cancer and colorectal cancer? So this is a great study that was done showing just the results of how effective vitamin D is. And this is just one portion of vitamin D, okay? We're looking at just cancer here, but there's the immune system, and I'll talk a little bit about that at the end, but there's the immune system. Literally every function of every cell in your body, vitamin D is required for all this stuff. And it's hugely important that we have enough of it, and we are chronically deficient in vitamin D as a species, but especially here in North America. So very, very important that we get our vitamin D. So the best place to get vitamin D is from brief sun exposures. Okay, the sun hits our skin, it activates cholesterol. I've done another vitamin D talk where I go a little more in depth on how that works, but it activates the cholesterol, goes to the liver, changes the form of vitamin D, eventually gets to our cells in a usable form and a measurable form, which is 25-hydroxy vitamin D that's found in our blood. So when you have blood work done, that's what they're measuring for. They're trying to see what's the 25-hydroxy levels of vitamin D. So that's basically what we measure vitamin D as, and that's not exactly the usable form by the cells, but there's another process there, which really doesn't matter. What we need to know is how do we get our vitamin D levels to where they need to be. So the sun is the best way that we can do that through that process. The problem is there's a lot of restrictions. It's not like, okay, just get some sunlight, right? It's got to be at least 15 minutes per day of sunlight. That sunlight has to come within an hour of noon, right? When the sun's at its highest and brightest point at 12 o'clock in the afternoon. So you need to be within an hour of that time there. You need 40% or greater of your skin to be exposed. So, that means look at, the winter months. If you live in Minnesota or something like that, how often are you going outside in shorts and a tank top? It doesn't happen that often, and we don't get enough sun. And the vitamin D, if you look at vitamin D just from sun exposure, that's one of the main reasons that the flu or any virus is more prevalent and people get sicker during the winter months because we're just not outside as much and we don't get as much vitamin D. So we've got to have that skin exposure. And also you can't use sunscreen. There's a couple of things. It's the UVB rays from the sun that are used, and sunscreen blocks those. Glass and plastic block those too. So like if you're getting sun through a window or something, you're not going to get the same effects. You won't have the process take place that needs to. So the best way comes down to supplementing because we cannot get enough sun. We're indoors too much now. We wear too much clothes. We wear sunscreen. We do all the things that stop vitamin D from being formed. So the best way to get it is going to be from a good quality supplement, which we're going to talk about here towards the end. But one of the main roles when we look at cancer and how cancer goes about, one of the main roles of vitamin D is its protein synthesis. All right. Now it's responsible for a lot of different proteins being synthesized. It's part of the chain, the reaction that happens for all these proteins to be synthesized. But the main one that they look at in this study is called the P53 gene. Okay, when you have the P53 protein, you actually suppress tumors. All right, so the tumor is trying to form, and it takes a long time. The way a tumor forms is your cells mutate, right? They're kind of evolving, they're mutating, and that mutation turns out to be beneficial for them from a reproductive standpoint. It's easier for the cells to duplicate themselves, and then they start to build together with these mutations, creating tumors. Now, the average tumor, when we look at colorectal cancer or any kind of solid tumor really, and breast cancer is one of those as well, it takes about 20 to 25 years to have a recognizable tumor form in those areas from this. Now, if the P53 gene is there, it suppresses the formation of tumors. So as long as we have it in high enough levels and working, then it doesn't allow tumors to form. But as we lose vitamin D, as we're deficient in vitamin D, we're actually suppressing the formation of the P53 gene. So tumors have a much easier time forming and growing. And that's what's happening. And they grow faster because the P53 gene's not there to stop them at all. Because we have such low levels of vitamin D in our blood that the reaction, the protein synthesis that needs to take place isn't happening. So lower vitamin D suppresses our P53, which allows tumors to form quickly. Now, if it's elevated, if we have correct amounts of vitamin D, which you'll see, it supports P53 being formed, and that stops tumors from growing, or at least slows them down significantly, depending on how much P53 protein we have in our body and near those tumor sites. So the vitamin D is the absolute crucial step in that for it to form, though. P53 won't form without it. So vitamin D, very important there. When we look at the P53 being formed and what that takes and how much vitamin D we need in our blood, what we find is we can actually, at certain levels, not even appropriate levels, but if we just bring it up some, we can cut these cancers in half. When we look at breast cancer, if you can get your blood levels up to 52 nanograms per milliliter, and that's just how they measure it, but the number 52 is important there, we can actually cut breast cancer in half at that point. The number of cases of breast cancer in the world in half if we could get all people at 52 nanograms per milliliter. When we look at colorectal cancer, that number is even lower. If we could just get to 34 nanograms per milliliter, we could cut the cases of colorectal cancer in half. Okay, that's huge. Now, we need to supplement, like I was saying, we need to get in the sun more to bring this up. But when you start talking about cutting those in half, I mean, we're talking about, if you look at colon cancer, 60,000 less cases in the United States, 85,000 less cases of breast cancer in the United States. If we could just raise our vitamin D, we're spending all this time and all this money on treating these cancers when they come along, when we could be spending time on preventing them. And it's pennies per day to just get a good vitamin D, right? I'll talk about it here in a second, but the daily dosage, our innate choice supplements, these are the supplements we use in the office because they're the best supplements that I've found. The one on the left here is the Omega A and D. So it has your omega-3 fish oils, which you guys have heard me talk about that before, and there's a ton of information about how important it is to have appropriate levels of omega-3 fatty acids in our body. Well, we've combined, I haven't, the company Innate Choice has, omega-3s with vitamin A and vitamin D. Now, A and D work synergistically together. So if you have appropriate levels of A and D working together, you actually get like a 300% uptake in the vitamin D. So you're going to use more of the vitamin D, your blood levels are going to remain higher, and you're just going to be healthier. So that is by far the best supplement that I have ever seen and ever used and taken myself and for my family. And that is the supplement I suggest. On the other hand, we do sell just vitamin D separately too. And I think it's important because everybody is so deficient in vitamin D, okay? And it's a dropper form, but it allows you to get the daily amount that you should. Now, the daily amount that you should, we want to get everybody, because the study goes on to say we would have even better results if we get everybody to 55 nanograms per milliliter, So if we can get up to 55 nanograms per milliliter, 55 to 90 is where they show maximum benefit with vitamin D. If we can get to those levels, we've knocked it out of the park at that point, right? We're going to be healthier. We're not going to be as susceptible to viruses and bacteria and things of that nature. We're going to be less susceptible to cancer. I mean, this goes over both those numbers we just talked about, so more than cutting those numbers in half because of that P53 gene we talked about, right? So in order for us to get up to 55 nanograms per milliliter or higher and maintain that, for an adult, we need to take between 4,000 and 5,000 IUs per day of vitamin D3. Okay, and a lot of places they'll use vitamin D2, and I see a lot of that come into my office too. And this study actually says vitamin D2 needs to be thrown out immediately and replaced with vitamin D3 because of the reactions and how it goes through, and it has to be converted into the 25-hydroxy vitamin D, and you lose some of it. So vitamin D3 is what we need to be taking. So, finding a good quality vitamin D3, and there's a lot of bad ones out there. I always have, as the doctors in our clinics, we always have our patients bring in any supplements that they're taking, and they're filled with fillers or inflammatory oils, or just they're synthetic and they're not natural, they're not organic, and our body just doesn't use that stuff the same way. So you have to make sure that you're on a good one and that you're getting those blood levels up in order for us to be able to, in this study, stop cancer, right? Or at least cut it in half. But overall, I mean, our immune system, like I said, is absolutely dependent on vitamin D3. And the less vitamin D3 we have, the more suppressed our immune system is. The more we have, the better our immune system is going to work and recognize viruses and flus and bacteria and all those things, right? So vitamin D3, absolutely crucial, especially the winter months, but not just the winter months. I mean, even in the summer, we don't get outside enough every day, right? That's what it requires, is every single day, 15 minutes within an hour of noon, 40% of skin exposure, all the rules that I went over. That's tough to do, even when it's summer. So it's very, very important that you find a high-quality vitamin D3. And like I said, Innate Choice is the brand that we use because it's the best one I've ever found. And I've looked a lot and tried to find a lot of them. So you have questions on that, get your questions answered about the D3 you may be taking or thinking about taking, and what's the difference between that and this one, and what can we do to best help you? Because, I know there's a ton of information. This was a 25-page article. For me to cover it in 12 minutes is pretty difficult, but you get the point. that vitamin D3 is huge when it comes to cancer in this article, but our immune system, our overall health, our well-being, our quality of life, all dependent on vitamin D3. Not alone, right? We need our omegas, we need our probiotics. You guys have seen all the other talks. That stuff's really important. Exercise, de-stressing, all this stuff. Eat well, move well, think well that we talk about, right? But in the research, we need to isolate these things to see what the benefit is from them. And vitamin D3 is a huge one. So, guys, as always, I encourage you to get into the clinic. This is the stuff we talk about with every patient every day. We stick to the research. We get our patients feeling better, moving better, eating better, thinking better, and just living a healthier lifestyle. And I know the biggest barrier that stops people from coming in is cost. It always is, right? And so what we do in our office for our first day is we sit down and have a consultation first and say, what is it that you are looking for and we need to do? And then we go through an exam. We use a proprietary health software that allows us to give you a personalized health score from 1 to 100 based on your lifestyle, how you're eating, moving, and thinking. And then we can see, okay, here's what we need to do. We take x-rays if we need to. We do whatever it takes and figure out exactly what we need to do to get you out of pain, get you back to living healthy, get you moving correctly again, get you back to just living a quality life, right? Normally the costs of that in the office is about $289, but we've brought that down to just a $39 donation from you to our local monthly charity. This gives us a chance to give back to the community. It gives you a chance to get into the office and get the answers that you deserve about your health, about pain, about whatever it may be that's slowing you down or not letting you live the most quality life, the life that you want to. So get in, get the answers, no more excuses. We've brought that cost all the way down for that donation. So just get into the office, give us a call, set up an appointment, and we look forward to seeing you in there. I'll see you for our next 12 Minutes to Health. Guys, thanks for being with us.